In this particular episode, we're starting off on a more serious note, and we want to give you a heads up. This segment will feature some mentions of suicide. Across dozens of states, a big issue for legislators is health care for transgender people, particularly the subset known as gender-affirming care. In 2023 alone, legislators have introduced more than 100 bills across 31 states that would restrict gender-affirming care. That's according to civil rights advocates at the ACLU. The bills usually address health care for folks under 18. It's part of a broader push to restrict aspects of transgender life, alongside recent laws governing the presence of trans people in everything from bathrooms to sports. Transgender people say these laws are an attack on their human rights and access to basic health care.
I could stand here and tell you about the times I attempted to end my life because I didn't have access to gender-affirming care, but I know you don't care. I see you sneering at us.
I take issue with the notion of describing some of the care, particularly surgeries, as mutilation. As someone who has undergone gender-affirming surgery, I know the light it brought to my life.
Legislative sponsors of these bills tend to be Republicans. They say providing this care is a threat to the well-being of children.
As adults, we understand that a child's brain is not fully formed and cannot comprehend the ramifications of making irreversible medical decisions.
And so it's my hope and the hope of this bill that by the age of 18, they will not want to pursue further physical or chemical treatments or pursue those treatments.
So what exactly is gender-affirming care? It's a set of guidelines for doctors that tell them to support and affirm a patient's gender identity when it doesn't match how they were assigned at birth. It includes everything from using proper pronouns with patients to counseling and therapy and medical options like puberty blockers, hormones, and yes, sometimes surgery. Radiologist and breast imaging Dr. Evelyn Carroll, a trans woman herself, told us gender-affirming care by its nature has to be pretty broad.
Gender affirmation is going to look different for everyone. I like to say that if you know one transgender person, you know one transgender person. And for some people, that may include hormones and surgeries, but for others, often there is no medical component of their gender affirmation.
Studies show this care can be life-saving, directly linking gender-affirming care to lower rates of depression and suicidality. That really matters for the transgender community. A study published last year in the Journal of Interpersonal Violence found that 82% of transgender people surveyed reported suicidality and 40% had attempted suicide. It's also worth noting almost every relevant large medical association is on board with the basic concept of providing non-judgmental care that affirms a patient's gender identity. We reached out to the American Medical Association, American Psychological Association, American Academy of Pediatrics, Endocrine Society, World Professional Association for Transgender Health, or WPATH, American Academy of Obstetrics and Gynecologists. All of them support gender-affirming care and have set up standards for how to provide that care responsibly. While specific guidance around issues like age minimums for certain treatments can vary, they're on the same page about the broader framework. While not everybody chooses to medically transition, most bills have sought to prevent folks under 18 from accessing puberty blockers and hormone therapy as well as surgeries. American Academy of Pediatrics guidance asks doctors, parents, and young patients to work together to figure out which treatments are right for them. Dr. Jason Rafferty led the development of their guidance, and he'll be helping us understand some of the most common medical treatments. Let's take a look at puberty blockers. If a young person is considering a transition or just isn't sure of their gender identity, a doctor can prescribe these to give a kid more time to figure things out. Best practices dictate that these aren't prescribed until a child is at puberty age.
Puberty blockers can be very valuable at that stage because especially for a young person who feels that their body's beginning to change, they don't have control, it's really distressing.
Puberty resumes after a patient stops taking their blockers, and most of their effects are reversible, but the threat of long-term bone density loss has led some European institutions to pause their use. Rafferty told us that that specific issue can occur if blockers are used for too long or too late into puberty. The American Academy of Pediatrics also notes more research is needed into potential risks to fertility. Patients can also undergo hormone therapy, getting either testosterone or estrogen to align more closely with their gender. These treatments are meant for later into puberty and aren't considered under guidelines until age 14 at the earliest. Most providers wait until a patient is at least 16. Hormones have less reversible effects on things like voice, hair follicles, breast size, and potentially fertility.
We want to make sure that young people can sort of reflect back and sort of be able to talk through why this is going to be beneficial for them. We want to make sure that adults are really thinking through reversible, irreversible when it comes to sort of effects, side effects, things like that.
After months or years of blockers and or hormone therapy, patients who want to go further can get top and or bottom surgery.
By and large, surgery is reserved for adult populations above the age of majority. There are some exceptions, specifically for what is referred to as top surgery, which would be sort of manipulating the chest for a mature 16 or 17-year-old on a case-by-case basis.
WPATH guidance does open the door for it to happen at age 15, but only in countries where 15 is the age of majority, meaning the age where a person is legally an adult. The US is not one of them. The age of majority here is 18 years old. Even then, Rafferty explained that any surgery for minors isn't something doctors take lightly.
It is usually a fairly intensive process of multiple team members weighing in to make sure that this is a qualifying, sort of case, that this would be a sort of exception. When we talk about bottom surgery, which would include any sort of sterilizing procedure or any sort of genital procedure, that is not something that any, existing protocol today is really sort of endorsing under the age of majority.
Some doctors worry that the political push for more restrictions on this kind of care could end up impacting patients of all ages. So now let's talk to a doctor who handles some of this firsthand. Joining us now is Dr. Beth Cronin. She is a professor of obstetrics and gynecology at Brown University's Medical School and provides OBGYN care at Providence Community Health Centers in Rhode Island. Dr. Cronin, thank you so much for joining us here on In the Loop.
Thank you. I'm thrilled to be here.
First off, how do principles of gender-affirming care apply to what you do as an OBGYN? What issues do you run into that feel particularly important or distinctive to your field of medicine?
I think the principles of all of the care we provide as OBGYNs is relevant here, right? It's patient autonomy, patient decision-making, patients having the right to control and get the care they need for their body to be as healthy as they can be. And, it's a unique field to care for transgender and non-binary patients in that, for years and decades, we have OBGYN in general has been the care of women. And so we've really had to shift as a field to acknowledge and recognize that we care for more than just women.
How much of a difference can some of these treatments make, not just for minors, but for adult patients too?
I think one of the most challenging pieces in doing this is life-saving care for some patients. For some individuals, gender dysphoria is so severe that it can lead to suicidal thoughts, suicidality, and really impact one's day-to-day life. And being able to access the appropriate medical care that they need to treat that condition can be life-saving for some folks. And so it's really important that everybody continue to have access to this care.
I know some of the job can involve surgery, especially hysterectomies. What does that discussion with patients look like? I mean, how quickly are people getting these procedures done? Are minors getting them? I mean, what can you tell us about, if you could pull back the curtain here?
The large scope of care that I do is patients interested in either sterilization, so removal of tubes or blocking of tubes for prevention of pregnancy, or hysterectomy, so patients that want their uterus removed completely. For minors, as I generally see folks in their late teens, early 20s as an OBGYN, but I've definitely seen folks younger than that. That conversation is a kind of long patient-centered conversation about what their goals are, what they're looking for. I have had patients who have had top surgery, so removal of chest tissue and chest reconstruction at younger ages. Those are patients who have had really significant body dysmorphia, really struggling with their body image, and have been having significant side effects from that. And these have been really life-altering and life-changing surgeries for those patients that have made those choices. Most insurance companies still require that, in addition to seeing me as the surgeon and going through the entire informed consent process, that they've also been living for at least a year in the gender they identify as, that they've had 2 therapists separately who have affirmed that and said that this is the correct choice for them. So they can't walk into my office and say, I want a hysterectomy tomorrow. I've never thought about this before. These are patients that have been waiting and this is not a rash, quick decision that anyone is making.
I think it's really important to hear from providers. I think it's really important to hear from people who are impacted, so we can get a better sense of what this looks like for folks who are affected. Dr. Cronin, thank you so much for joining us.
Thank you so much. It's a pleasure to be here.